Is there a correlation between temperature and COVID-19 infection rates?
When conducting our investigation, we found out there is a strong correlation between temperature and infection rate. So we learned there is a 10% decline in transmission with each 1 degree increase in temperatures above 5 degrees Celsius. Also that at a temperature below 0 degrees Celsius, the epidemic growth rate is constant but begins to decrease at temperatures above. And that when mean temperature was under 3 degrees Celsius, each 1 degree drop in temperature associated with a 4.8 increase in COVID-19 infected citizens. An example to this is shown for the countries US and Ghana. The US, being a developed country, should have a lower increase rate than less developed countries due to their healthcare system and other factors. However, cases in the US were registered in January, thereby the first infected were in winter. Nowadays, we can see a total number of cases of 2,266,655, with a total of 4,634 deaths, while other less developed countries such as Ghana, where the first citizens were infected in the hot season with a low average of rainfall, still have a much lower number of infected citizens and a much lower number of deaths in relation to their total population.
Of the association between temperature and number of COVID-19 cases has been scarce to date. The diversity of climate in Japan has enabled us to examine the relationship between temperature and number of cases to some extent. They used the Poisson test to measure the correlation between two variables, although other confounding factors such as humidity could not be included, which might have influenced the results. To finish, it can't be said clearly whether temperature definitely affects infectivity, but there is some indication of that correlation.
Conclusion: we can't be certain of an answer due to the lack of information, research, and studies done on this topic. However, something we can rely on is our caution to the situation we are in and constantly informing ourselves through credible sources.